We'll go ahead and get started here in about a minute or so, but I just want to let everyone here know thank you for coming out tonight. Thank you for, you know, putting in some extra time to wanting to learn more about sports residencies and taking time out of your day just in general. If y'all have any questions throughout the presentation, if you want to throw them in the chat, I can ask for y'all. If you want to unmute and speak up, that also works. But without further ado, let's go ahead and get started. So again, thank y'all for coming. Today we're going to have Dr. Elise Bjork give a little presentation about sports residencies and just a day in the life career as a sports PT. Just a little background on her. Dr. Bjork received her bachelor's degree in biochemistry from University of Texas at Austin in 2011. She then completed her DPT from Texas Women's University in Houston in 2015 and returned in 2021 to begin her PhD program in physical therapy. She's also working on a Master of Arts in Religion at the Episcopal Theological Seminary of the Southwest, in which she focuses on liberation theologies with the hope of connecting with those methodologies to the battle of systemic oppression within the healthcare system. She completed her sports residency through Evidence in Motion in 2016. She became a board certified sports clinical specialist and has worked in outpatient sports and orthopedics for adults and pediatrics. She was also the head physical therapist for the Austin Soul and Austin Torch professional ultimate frisbee teams from 2016 to 2019. And she's currently on staff at the University of St. Augustine as a head instructor. Is there anything I missed there, Dr. Bjork? You want to add anything else?
No, that's good. That's yeah. Thank you. Nope, I just wonder. Well, yeah, thanks for being here, y'all. So I figured I would just kind of talk a little bit about some of my experience and then some suggestions, recommendations if you're interested in sports PT, things to look for, how to look, and then happy to take as many questions as y'all have. But yeah, so yeah, like Garrett said, I went to Texas Women's University and finished up in 2015. The whole time I was in PT school, I knew that I wanted to go into sports. And being in Houston, we had some access to higher level like professional sports through the university, which was great. And I remember specifically the head PT for the Houston Texans at the time came to talk to us. And so that was really cool to get a taste of what that life might be like, because I had originally thought maybe that was a route I wanted to go. But after hearing him talk about 100-hour weeks and in season and 80-hour weeks in the preseason and 60-hour weeks in the off season, I was a little discouraged from that work-life balance. So that's what he was saying the hours per week was working for an elite professional football team. So yeah, so I kind of decided to just focus on more outpatient general population instead of pursue that elite pathway. And I did a sports residency through Evidence in Motion, which is one of the hybrid models that's out there. So that's essentially meaning that I was working full time at a clinic, and I did online coursework kind of independently, and then met up maybe every two months for a weekend intensive where we focused more on manual skills and kind of fine-tuning manual skills, learning a little bit more than we learned in the DPT program. There are other residency models out there that are more in-person centric. So Memorial Hermann and Methodist are two examples in Houston that do more, you go to class in person. So your clinic load is offset a little bit so that you have a few hours of the day to go do that, or to go do rounds at the hospital with orthopedic surgeons and do that sort of thing. So that's one thing that I'd like to recommend to y'all to figure out what works best for you when you're looking for a sports residency is, do I need more like independence and more flexibility with the schedule, or do I want that really like immersive experience of like being around all the different healthcare professionals and being in the classroom a little bit more? So take a look at that. For me, it just worked out to have a little bit more flexibility. I knew I wanted to be in Austin, and so that was the only option in in this city. But larger cities typically have both options available, and you can look outside of the state for hybrid models too. You can, of course, move outside of the state to find in-person models. So one link that I have pulled up that I'll drop for y'all in the chat is just the, let's see, yeah, this one. This is just the directory of sports residencies in, where's the chat? There it is. Okay. In the whole US. And if that link doesn't work for some reason, you can always search sports physical therapy residency directory, and that usually pops up there. But you can use that website to kind of filter through locations or different models. You can do advanced searches based on like tuition, so whether you just pay tuition or whether there's a salary at the same time. So that's another factor to think about in decision making. Is some models will have you make like a normal PT salary, and then perhaps there's tuition for the residency on top of that. Sometimes a company will cover that. Sometimes they might only cover part of it. Some companies use a model where they do a lower salary for residents and then pay for the residency to like make up the difference. And then, yeah, so just kind of whatever needs you have around that, you can sort through the directory too. But overall, evidence in motion kind of had you walk through some core classes, so like upper extremity, lower extremity, and do some more fine tuning again of the manual skills and your thoughts there, in addition to having sports specific classes. So we dove into exercise science and physiology in a lot more depth than I had in my DPD program. We talked about specifically certain types of athletes, so like the master's athlete, meaning those over like age 50. We talked about the female athlete in particular and like the specific considerations for them. We also had a course on like integumentary issues, because that can be a big thing in sports like wrestling. And let's see, overhead athlete was the last one, overhead athlete. So yeah, so those were some kind of specialized classes that I think might be offered in different programs, but really every program is pretty different. There's only a few kind of standardizations of things like to check off that you have to do. So there's conditions that you have to, talk about in a residency program. And then I have another link here. Then there's venue coverage hours that have to be completed. And there's amount of mentorship along the way. So the second link here is the description of sports programs. It's kind of long, but you can get an idea of like what particular topics are covered in a sports residency, if that's helpful. And then how that's delivered is different just across each program. So the other thing that I like to mention about picking a sports residency is to think about what you want out of a mentor. So every sports resident will have one or more mentors who, at the very lowest end of work for a mentor, it would be checking in weekly about patient cases that you're treating in clinic. They would be kind of watching you treat a little bit, or maybe reviewing notes and just having discussions about how your management of those cases is going, as well as contributing in some fashion to your sports venue coverage. So maybe finding an athletic trainer mentor or themselves going out to sports venues and kind of guiding you through what that process looks like from off role. More in-depth mentors will be, right there on your shoulder while you're treating and quizzing you and giving you questions before and after, and really helping you be as specific as possible and as intentional as possible with everything. They'll be connecting you with a variety of other health professionals. So again, orthopedic surgeons, athletic trainers, PT, strength and conditioning professionals. They'll be making sure that you experience a variety of sports in your sports venue coverage, including also things like performing arts, tactical training, sorts of things. Those all fall under sports residency. And yeah, so think about what you want in the mentor. Do you like having that really hands-on, like quizzing you in your face kind of mentor, or do you prefer to have a little bit more self-discovery and then check in with someone, or somewhere in between? So as you start to look at programs, you can also look at the faculty there who are involved in residencies, or the clinicians, depending on what the model is, and think about who you would want and ask questions going in to applications, like, would this person be available to be my resident mentor? Uh, and that usually it goes well with the resident mentors if they feel sought after, right? Everyone wants to feel sought after. So um, yeah, so that can be a good thing to look at too. Otherwise, it's the day-to-day life of a resident, again, can vary across programs. My experience was I was treating in clinic 40 hours a week, plus maybe an additional hour or two of notes each day that I was finishing up. And then I did 4 to 6 hours of schoolwork on top of that each week, perhaps. And that's, again, just going over like discussion posts and online lectures or reading journal articles, that sort of thing. And then again, the weekend intensives are like 8 to 5 Saturday and Sunday to brush up the manual skills. The sports venue coverage hours are, again, 200 for the whole residency. So 12 to 18 months is usually how long a residency takes, depending on the model. And so those hours can be kind of wherever you want. Some programs have really established relationships with different sports venues, with schools, high schools, middle schools, or with professional sports or recreational sports leagues, and you can kind of get in and do coverage there. You're supposed to have a mentor on site at all times. So that might be your like physical therapist resident mentor, or it might be like an athletic trainer or someone else who's kind of just done the paperwork to get approved to say like, yes, they have the credentials to train you. And that's usually athletic trainers or physical therapists. And again, so that's the goal there is to just be the person going on the field when an injury happens in the moment. So being able to make choices about when to move an athlete, when to pull the athlete off the field, how to assess the athlete for the possibility of going back into the game, or whether to keep them out. Do I need to send them to the hospital and engage an ambulance? All those kind of clinical decisions are something that you don't get in a DPT program, that you do get a lot of hands-on practice with in a sports residency. I think those hours were super, super valuable. But again, they will vary largely with the program. So the really well relationship built programs will have established relationships with really good programs, like even professional programs. And then there will be some residencies where it's like, okay, you can kind of figure out how to get your own hours, call up the local softball league and go watch and see if something happens. So that's something that, again, would be helpful for you to ask about as you start to look, is how does each residency program provide opportunity for sports venue coverage, and what kind of mentorship is available during those hours to make sure that you get what you need out of that. And it's not just, sitting in the bleachers watching the softball game necessarily. Yeah, what else? You do have to get a certification for the residency in emergency medical response. So it's called an EMR, and that's a course through American Heart Association, typically, where you do some, again, online coursework for a few weeks prepping, and then you come in person and you learn things about concussion management, you learn about spine boarding athletes, you learn about if an athlete gets impaled by something, what to do about it. So kind of some basic first aid or more advanced first aid. And as well as that spine boarding piece, concussion, your CPR, those sorts of things. So that's a requirement to keep up as you become a sports clinical specialist. You're supposed to keep that up, and it lasts about 2 years typically. What else? So coming out of the residency, you apply to take the board exam to become a board certified sports clinical specialist. And that is somewhat similar to the NPTE in style. There is usually like 5 sections of 50 questions, multiple choice. The questions are more difficult than the board exam itself. and they're all sports focused. There are prep programs for that. Usually most residencies have one of their own or point you in the direction of one, but yeah, so that's the same thing. It's only offered one time a year, which is unfortunate. It's always offered like around March every year. So one thing also to look at as you start a sports residency is to make sure that the schedule maps where you'll be finishing like in January, perhaps, so that you have a few study months before the March exam. I know when I was first hired, it was going to work out where I finished in March, and that wasn't going to be good. So yeah, so that can be something to look for. Otherwise, yeah, so you take the board exam. It's your license as a sports clinical specialist is good for 10 years. You do have several recertification steps along the way. So every 3 years, you have to submit proof that you've been treating athletes in clinic at least half the time, or it's a certain number of hours, I think, and that you've kept up your emergency medical response training, and that you've done some continuing education specifically in that athletic clinical settings. After the 10 years, you can just recertify without taking the test, or if for some reason you let it lapse or you haven't kept up with the CEU things, you do have the option to take the test again if you want to. It is an expensive test. I think when I took it, it was like $1,400 just for the one test. So that can be something to think about budget-wise too. But yeah, otherwise, I think being a resident mentor has been another thing that I'll just speak to briefly before questions, but being a resident mentor has been valuable as well, just to work with different folks. I was reflecting today and realizing that all of my residents have gone off and like started their own businesses in sports PT, which is cool. So they have their own clinics and their own like specialty sport that they most likely played, and then treating that population now. But there's not any like business stuff in the sports residency necessarily, but it does like give you the expertise to be an attractive clinician to athletes. So there is a little bit in sports residencies about community outreach maybe and that sort of thing, like working with teams, navigating coach relationships and strength and conditioning relationships. But yeah, what else? I'll just pause. Any questions so far?
I'll ask one, Dr. Bjork.
Mhm.
So I'm assuming I am like most people in here. I was formerly a college athlete,
Mhm.
and I feel like that's what draws most of us to sports PT, or you played sports growing up, whatever the case may be.
Sure.
I think when people think about physical therapy, sports PT is one of the first types of physical therapists they think about.
Mhm.
So because we know that it's a competitive industry, and I know we were talking a little bit before you started giving your official talk, but is there anything students could be doing now
Mhm.
or in the future, early on in your career, to kind of separate yourself from from the competitiveness and just develop your clinical skills?
Yeah. Um, yeah, so we talked earlier, I'll mention about different certifications. We were talking about the CSCS, Certified Strength and Conditioning Specialist. That can be that's definitely helpful knowledge, I'll say. Having knowledge of specifically dosing and like how to really be specific about exercise science and prescription and periodization. That's helpful knowledge to have. The credential itself is helpful if you're gunning for one of those elite, like professional athletic worlds. If you're just going for like sports specialty in the outpatient, then it may be less important because some like recreational athletes or competitive athletes, but who are not professionals, may not know what the credential is or bother to look it up necessarily. So again, the knowledge is helpful. The credential is hit or miss. You're not going to get a higher salary for having that in the general outpatient sports setting. Um, but again, it might be a key factor to differentiate you if you're looking for a high level job at a pro athlete place or at like Exos or something like that. The Other like certifications in like different types of manual therapy or soft tissue work can be helpful. Dry needling. Um, these can be expensive. So that's definitely a limiting factor. If you're just able to learn and not necessarily have a certificate, that's also okay. You can still list those as skills on your resume, just not like a certified provider of blank. But having those skills and saying I can include this in my treatment is helpful. Otherwise, getting involved with as many different types of organizations as possible. Getting to know people in the world that you want to go work in. So reading their journal articles. If you say, I want to go work for the Texans, like who are the PTs for the Texans right now? Who are the athletic trainers? What have they written on in the literature, if anything? What problems is the team having? If there's any like media coverage, like you can go all in and kind of just email people and say, hey, is there any opportunity to shadow, or do you need help with any research, or anything that'll kind of get your foot in the door and get your name in their head is helpful. Um, so it takes a lot of work. It takes a lot of work to get in that arena. Same thing if you live in a town with a university. That can be a good place to try to touch base and see if there's shadowing opportunities. One of my previous residents just got accepted into a D1 sports fellowship, which is a whole new kind of category of sports expertise. So we have residencies are like 12 to 18 months. Fellowships are usually a bit longer, 2 or 3 years, and just go more in depth. So this D1 sports fellowship is something um, pretty new in the last few years, I think. Um, and he was saying that it was frustrating because like one of the criteria is that they already have experience in D1 sports. And so he had been volunteering at University of Texas, and so he was able to get that. But one place that declined him said they wanted him to have more. So again, if you can find any windows or anyone that you know or that your friend's friend knows that can get you plugged in, that's a helpful thing. Going to conferences, again, going to talks where Kevin Wilk is talking or whoever is talking, and chatting with folks there, going to the sports SIG meetings, that sort of thing. Having usually some leadership as experience is great too. So things like being a leader in this organization or in your respective SPTAs at your universities, that always looks good. Volunteer stuff always looks good. But usually it's these specific sports experiences that take one person above the next. What else? What would y'all like to know?
So I know you mentioned earlier about you had somebody that kind of was he was PT for the Houston Texans, and you said that he was telling you about what his weeks look like, and what exactly did those, like the day-to-day life of a professional sports physical therapist look like?
Yeah, so he would come in early in the morning, like 5 a.m. They would do treatments for the athletes, specifically the injured athletes, and then sometimes just like preemptive treatments for the non-injured athletes if it was close to game day. Before, then they would go into practice and come out and they would do more treatment. So he would cover sideline while they're in practice. And then when practice ended, they would go back to the treatment room and do recovery things. So compression, ice, mini soft tissue, different types of stretches, or treat acute injuries if they occurred. And then there was usually some sort of break and then another type of practice perhaps, or maybe they were just working and planning with the strength and conditioning coaches about workouts. So each athlete in the professional sphere has a very, very personalized and specialized plan for their strength and conditioning training and for their rehabilitation. So they're tracking tons and tons of data about not only like vitals, but also like impact that their body takes during practice or during games. The joint angles, even like the acceleration moments, all kinds of data. So um, we've had at St. Augustine several folks from like the NBA, I think one from the MLB talk as well, and so they all are corroborating that regardless of what sport there's a lot of data on athletes. And so they're using that to figure out what is the right recovery for this person, in terms of nutrition, in terms of sleep, in terms of do they practice the next day or not? How much rest do they need? How much should we push it? And then balancing again, like strength, power, hypertrophy, endurance training based on the sport, and then all that data coming back. So there's a good amount like spent analyzing some of that. Some of that's done by AI and programs, but there's still always human eyes looking it over and checking in about how an athlete is responding. On in-season like games, they would travel obviously with the team, so they would do treatment beforehand. They would travel to the games and be providing sideline care for athletes and assessment. So that, could involve going into the back room, doing imaging, assessment, pharmaceutical provision, which may not be the PT, but they're certainly around. And then, that assessment of should they or shouldn't they return, and then again, recovery and starting it all over the next day. So his days were usually like 5 a.m. to like 11 p.m. sometimes, when there was really in the thick of it. But sometimes some time off in the middle of the day, just depending on kind of when the team practiced and what they were working on. And then off season was a little more compact, so a little more like a 7 to 6 p.m. kind of day, with still similar things, being in the weight room, being in the recovery room and the training room.
Thank you.
Mm-hmm.
I have a question.
Sure.
Going off what Garrett said, with how competitive it could be, with us being kind of like pre-PT in the early stages, we are kind of limited to kind of some of the certifications that we could get. What would you say is like some good certifications we could kind of get now to kind of help us elevate or get towards that point of like when we graduate, we'll get to like the dry needling and like the strength and conditioning and stuff like that? Would you say just the volunteer hours at different places would be a good way to start? Or
Yeah, I think that would probably be the best way, is to try to network as much as possible, volunteer as much as possible, to start to think about like where you want to be and like what are the people who are already there, like what does their resume look like, that sort of thing, and then see if you can like plug any of those pieces in, either if it's a bit of knowledge that you're gaining towards an eventual certification, or maybe it's just diversifying experience like you see on their resume. A lot of resumes are public, but not all of them. But I found that people in the world are fairly open to like helping students like yourselves get into this world, because they know how competitive it is. So sending emails and just saying, hey, what do you recommend? I want to be where you are. Here's my resume. Do you have any needs yourself? Those can be helpful things. Yeah, probably more so than a certification now if you're limited by license.
thank you.
You're welcome. So if you're not treating in like the elite sports sphere, there's still, it's kind of more of a normal clinic day, just to speak a little bit to what that's like. But typically you get more high-level athletes. And so again, we are experts at exercise prescription, exercise science, more so than our orthopedic specialist counterparts. So usually that's an area of difference. Sometimes they have sharper manual skills, so that can be a thing to bolster or make sure you're keeping up with as you go through a sports residency, so that you still have strong manual therapy skills in addition to the exercise science skills. But otherwise, there's kind of wherever you end up. So if you end up at a cash pay place and have a lot of one-on-one time and more equipment available, then your day will look a little bit different than a higher volume outpatient corporate company. But either way, we're still like uniquely qualified to treat athletes and be more specific. But I will say that you don't always get a big pay bump if you're working in that corporate, like outpatient kind of setting. You should get something for being a specialist, but it's not going to be like a huge increase in salary. If you're at a cash pay place, it's usually more based on market and like how much marketing you do and what your client schedule is and that sort of thing, how much your name is worth, how much your credentials are worth. So again, think about that if you're not interested in more in the professional, but just in the city local level of sports PT. And then you can volunteer at with different sports or athletes or whatever you want to work with, whatever population that is. So like Garrett mentioned, I'm an ultimate frisbee player, and so I had done the PT kind of stuff and sideline care for the two like semi-professional teams that we have here in Austin. I no longer work with the men's team, but we did originally, and we did a study one year on like injury epidemiology and kind of surveying teams about what injuries are common in the sport. So there's kind of some research options too when you have that many people. And there's opportunities for like pre-participation screening to make sure you get ahead of potential injuries as much as possible. And then depending on if the team can have like a strength and conditioning coach, that's an option too, as well as sideline care. So those opportunities are kind of, you get back what you put into it. So if you want to make that opportunity for yourself, there are certainly sports teams out there who are wanting help in your cities. And that can be another like connection thing. Maybe you volunteer for a little bit doing that with the expertise that you have. I think that anyone can get an EMR certification, but I can't remember exactly. Yeah, okay. Because I've only got it since I was licensed, but yeah, that's great. So that is something that you could do now if you want to try dabbling in some sports venue coverage before you get there. I see. Oh, hi, Terrell. Would a connection with your local professional wrestling organization like WWE, not Olympic, be a good connection to have in regards to sideline hours? Yes, absolutely. So sideline hours can be anywhere from like low level rec leagues or middle school or like 5-year-old flag football league all the way up into like professional level D1 athletes. So anything is pretty fair game in terms of sideline hours, and yeah, so that would work.
Excuse me.
Yeah.
So, I had a question real quick. So I'm not sure. I never hear about it, so I'm curious. Whether if there's any like sports physical therapists that work more with, let's say, martial artists or like more professional, like UFC or MMA fighters, because I know that's very individual and sports PTs, they usually work with teams or something like that. But I was wondering, like in your experience, if you've heard of any sports physical therapists working with like any sort of martial arts.
Yeah, definitely. Definitely. We had one come and speak at St. Augustine recently. I can't remember if it was MMA or UFC now in this moment, but yeah, they were associated with a gym, like a training gym, and would work with athletes there who were training or competing. And that was really interesting because it's a very they have a strong mental game, right? They endure a lot of injuries, and so a lot of that profession from their perspective was like, okay, they have a broken arm, they're going to go back in and still compete and fight. And so what can I do to like mitigate the damage of it? So some more extreme, you might say, examples. But it's really like, again, our job is, what does the athlete need to do? What do they want to do? And how do I help them get there while providing my guidance, while providing information about as much safety, and then they're an adult and they make a choice about like how to negotiate all that information. So yeah, it was really, really interesting. A really committed athlete group for sure.
Thank you.
Mm-hmm.
I'll go ahead and ask another question, Dr. Bjork. So what might be some differences that you would getting your SCS and your OCS? Like what might be the difference in the structure of the residencies? I know you mentioned a few of them earlier.
Yeah, that's a great question. So in orthopedics, in my experience, folks have said who got their OCS had a little more emphasis on imaging, more emphasis on pain neuroscience education. So a little bit more emphasis on manual techniques, perhaps. We learned a good amount still, and it was pretty consistent with my DPT program, but they dive in a little bit more to that and maybe variations on more specified things about first rib and upper cervical and things like that. What else? They don't have the sports venue requirement, so they don't have an additional requirement. It's just the coursework and the mentorship hours. Yeah. So I think that's mostly it, other than the so we have a little more focus on integumentary conditions, more focus obviously on the sports venue hours, athlete specific things, exercise, science, and prescription. Yeah. I think that's a good summary.
Thank you. And then we have another question in the chat from Carrie. If you decide to work in an outpatient clinic, is sideline coverage something that you're required to do in order to keep up with your license?
Ooh, I don't think so. You have to keep up with your EMR. So the emergency medical response they would use on the sideline, but I don't think you have to work with athletes in the venue itself. Yeah. That's something that I just kind of naturally do, so I don't think about it as much when I'm logging things. But yeah, I'm pretty sure that it's just you have to prove that you've worked with athletes. And so that does cover, so if I'm someone who doesn't work in clinic full time, but I do sports venue coverage, that counts as me treating athletes. But I could get all of my hours treating athletes in a clinical setting if I'm not doing venue coverage. So you can definitely be an SCS and just be in a clinic job.
So Dr. Bjork, I know in your class movement science too, we go over a lot of return to sport testing. Do you have any favorites that you like specifically as a clinician that you tend to use more than others?
Yeah. Most of my population is field athletes. So running, jumping, twisting, those sorts of activities. And so I guess field or court athletes, but overall I try to think about the task, like what is the, what are they trying to get back to, where are they at, and what's missing in the middle to get them there. But assessment wise, I want to make sure that all the parts of their job as an athlete of their sport are represented in my battery of tests. So what kind of strength do they need to have? What kind of muscular endurance do they have, or VO2 max do they need to have? What type of power and explosivity or symmetry or asymmetry is helpful for the sport, and then kind of design my test battery there. So hop testing is definitely a go-to. I prefer the hop test battery from Ebert, which is 6 tests. So there's 4 common ones where you hop forward, single leg hop, and then 3 times forward, and then a zigzag pattern, and then 6 meters as fast as you can. But I also what they added was a medial single leg hop and a lateral single leg hop to assess frontal plane stability and explosivity. And then a vertical jump, I think, is important as well. So a single leg vertical jump. So that again is just helpful for the lower extremity. For the upper extremity, it's kind of all over the place. In terms of test batteries. I don't love many of them, and so I sort of design my own sometimes based on like how much stability versus mobility is needed, or strength versus power, or endurance, that sort of thing. So sometimes it looks like just like a ball throw and we're measuring acceleration, or how far they can throw is an easier way to measure if you don't have cameras and things. Or measuring repetition of power if that's relevant. I definitely think it's allowed and encouraged to kind of create your own test batteries to be more specific as possible. Like use what's in the literature and what's been validated, but manipulate it as you need to. So for field sport athletes, we're doing hop testing. For the low extremity, we're doing sprints based on whatever their position is in their sport. Maybe that's a short 10 meter, maybe it's a 40, maybe it's 100, maybe it's a mile. We're doing agility and plyometric assessments, again, with hopping or just one movement instead of multiple movements. And then, yeah, similar for upper extremity. So be creative with it. I encourage you to be creative with it, but always ground it in the literature. I'll put my email address in the chat as well if you ever want to think of another question or want advice about anything as y'all start to look into residencies or fellowships or anything like that. The other fellowships I'll mention that they have right now, we have several sports ones. We have the D1 Sports Fellowship, we have the Overhead Athletes Fellowship, and there's also one in Performing Arts. So if any of those interest you, that's another path of specialization. Question in the chat, do residencies and fellowships have to be run through some entity, or can you approach the therapist or location directly? So they have to be through some sort of a company that's gone through the accreditation process with the American Board of Physical Therapy Specialists. So there's a procedure for saying like, okay, this program has met all the requirements for us to say sit for the exam. But you can always approach a therapist like who works for one or something and say, hey, I'm really interested in this fellowship or residency. What should I do to bolster my resume, or how can I, get started and that sort of thing. But it can't just be you come to me randomly and I approve that you're a fellow after a certain amount of time.
So I know you mentioned when considering a residency or even fellowship that you want to look at like the mentorship structure,
Mhm.
as well as considering what type of sideline coverage or how much time you're in the clinic.
Mhm.
Is there any other factors that someone should consider when applying to the residency?
I mean, I think it's always great if you can figure out who other people are that went through it or been there and kind of get their internal perspective on how it was. That can be easier in like corporate settings where it's just like all the clinicians are on the website. If it's more of a university setting, it may or may not be public. The contact information may not be public. That's good, but that can be a good thing to kind of get some insight on. Yeah, I think mentorship is the big thing. Cost can be a big thing. Like the work to school, work to residency balance can be a good thing to understand. In person versus hybrid, I think is important. Yeah, I think that hits most of it, venue coverage. So it's going to just be different for all of you. Like think about what you want out of it, and then find a program that fits your life as well, outside of what you want in the career path. So there's lots and lots of residency options. Fellowship options are pretty limited, but lots and lots of residency options. So really peruse that directory and play with the filters and see what the options are.